Hope Channel is sponsored by the World Seventh-day Adventist Church. We believe in being people of the Word, people of prayer, people of deep study of the prophetic writings, people who love Jesus Christ, people who keep all the 10 Commandments, people who are compassionate, who respect others, the community, and world needs, people who live healthfully by avoiding tobacco, alcohol, unclean meats, drugs, and immorality. We believe in joy. We invite you to be a person of hope.
More practical tips. More up-to-date info. More certified resource persons. More timely themes. And more fun. This is Dynamic Living 2013.
HIV/AIDS remains to be the #1 killer worldwide in terms of infection. And of course, we know for a fact that globally, there are 35.3 million people affected with the disease. And 2.1 million of these 35.3 are adolescents. These data are quite alarming, and it should be of concern to each one of us. Dynamic Living, the Total You, invites you, dear viewers, in the next 60 minutes as we try to celebrate with the Department of Health as well as the different NGOs on the celebration of World AIDS Day. I am very much honored to have with me here in the studio as guests our experts, people who know from left to right, from 1 to 10, HIV/AIDS. I'd like to welcome to the show Dr. Evelyn Magsayo. She's with the Department of Health and in charge of the program for HIV/AIDS. Maayong gabi, Lynn.
Ay, maayong gabi, Doc Jane. Thank you for inviting and here.
Yes, and of course, we are also joined by Miss Fritzi Estoque from the Misamis Oriental Cagayan de Oro AIDS Network. Good evening, Jan, Miss Fritzi.
Good evening, Dr. Jean. And together with the Mocan family, we would like to thank you for this opportunity.
Yes. Heto nga, di ba, ngayong araw na to, supposedly, is your celebration for World AIDS Day. Kaya marami kayong activities na naka-line up. And we're so happy na napag-unlakan ninyo kami. Now, Dr. Evelyn, correct me if I am wrong, but it says that according to the registry, from the World Health Organization, there are 7 nations or countries globally na medyo mataas or increasing pa rin ang number of new cases sa HIV/AIDS. We're talking about the new cases kasi alam naman natin na marami talaga tayong kaso. But the new cases, kasi yun yung ating concern. And 2 of these countries, of the 7 globally, Asian country. And then of these 2, #1, isa nito kasama ay ang Philippines. Paano kaya nangyari ito?
Okay. So, totoo yan. That's true, Doc Jane. According to the global report of 2012, now we belong to the 7 countries that have an increased HIV cases, new cases, for more than 25%, while the rest of the reporting countries in the world, that is more than 130 countries reporting in the global report, is that they're already declining and some are stable. Itong nangyari sa atin, there are 2 phases. It could be, the good news is probably, is many of our Filipinos are now aware of the services where they can avail of the services to be diagnosed, to know their status, and it's a good thing.
Yeah, kasi minsan dalawang bagay yan
Yes.
Meron na tayong mga kaso pero hindi natin alam kasi una, walang diagnosis.
Yes.
Heto kasi parang meron na silang mapuntahan
Yeah.
para sila ay mabigyan ng advice
Yes.
at saka mag-guide sila, no? So
Yes.
that could be one reason. The other reason would be
And I'd like to add on that, of the estimated number of cases, 50% lang ang nakita natin.
So, nasaan yung 50%?
The other
Wala pa.
50% hindi pa.
Okay.
But the trend is there. It's going up. So I said the good news, but the other part is probably there is a fast and furious, according to the NAC, there is a fast and furious transmission of HIV. So the spread of the virus is now fast, and it's changing the profile from the heterosexual group, since most of the cases that were reported now is mostly sexual.
Yes.
So, and there is a change in the pattern, and it's more on the males having sex with males.
Kasi, di ba Fritzy, let me ask you muna before kusundan yung kinikwento ni Dr. Evelyn. Paano ka naging involved dito?
When I had my first employment way back early 1990s, after 4 or 5 years, our university conducted a study. And at the same time, we got a project from the NGO dealing with HIV and AIDS advocacy. Nabigyan kami ng grant to do the community education in the barangays. So that's when it started.
Okay, so
and during the time, mid-1990s, during the time, I was still very idealistic, very young, but I found out that very few are into this issue, doing the advocacy thing and all. So that's when I realized I have to get involved with this. Not just involved lang, but really actively.
So, balikan natin, Miss Fritzy, yung sinabi ni Dr. Evelyn na heto kasi, there's a changing pattern. Siguro, di ba? Dahil alam naman natin kung ano yung mga modes of transmission. Di ba? So, yes, Dr. Evelyn, yung modes of transmission natin talaga for the virus. What would be? Yeah.
Yes, that's for the virus. Yeah. And according to the National Epidemiology Center, NEC, ang sabi nila is, bali, parang more, the behavior is changing. So more risky ang behavior of our, especially the young adolescents or the younger population.
Kaya siguro pumasok dyan yung sinasabi natin na data na as of 2012, 79% ang increase And then heto, nasa age group 15 to 24 years.
Yes,
so yan yung sinasabi mo siguro na mas ano sila
true.
Ngayon, risky yung behaviors nila.
Kaya kung ikumpara natin previous years, heterosexual. So, yun, babae, lalaki lang. Pero ngayon, there's a change. More than 90% of our reported cases now are being transmitted through
the men.
Men having sex with men. Or we call that now males having sex with males because they're getting younger before reaching the age of our
18.
And there's 15. We have as young as 15 years old.
So it's kind of alarming, di ba? Kung iisipin mo yung data na sinusundan natin, and this is supported by facts and statistics. So hindi natin pwede sabihin na hindi totoo ito. So dati kasi, we know also for a fact, even kayo sa inyong mga advocacies, na ang pinaka-common na transmission would be needle injectors, di ba? Sa drug users natin. Tapos yung sexual nga, sa mga babae na nanganganak through deliveries, di ba? So yung mga babies nila nasasali doon sa nadadamay kasi pagpanganak ng nanay, nandun na nga, positive na yung mother. Pero ngayon, yung sinasabi mo is the change in the sexual behavior or preference.
Kaya there are 3 modes, main modes of transmission sa the HIV virus. So, sabi natin blood and blood products, no? Through blood and blood products. And the second is unprotected sex, and then penetrative sex, and then mother-to-child transmission. Although all of these 3, meron tayong cases reported, transmitted. But ang pinakamarami is this one, sexual transmission, which is unprotected, penetrative sex.
So, masasabi niyo ba na with all, kasi syempre, pag sinabi mong blood-to-blood products, heto naman sila, ini-screen naman yan
Yes, screen. Kaya very less likely nga, especially that we have a national voluntary blood donation program. So, we're prohibit ang selling of blood it's always voluntary donation of blood because that is where we want to assure the safety of our blood. So tinitest, screen, very thorough ang screening natin for blood to be
Given to
given
other
to
patient.
other patients. Kaya even good thing sa ato ang region, wala tayong case na blood na transfuse na positive.
So now we will try to
Okay.
correlate yun, national data yun,
Yes.
world data yun. So dito, let's talk about it locally. Sa atin naman, I read in a newspaper or a daily where it was mentioned as of May 2013, yung 95% ng bagong mga cases natin dito sa atin in Cagayan de Oro alone,
Yes.
is in the age group of 25 to 29. Before I discuss that, heto ba, are we aware also na marami talagang cases na tayo? Kasi di ba na parang nababasa natin na red flag tayo ngayon ang city natin. Yes, hotspot.
Sabi nga, hotspot tayo. That's very true, Dr. Jean, no? Kasi, when we had them counseled, mga 25 or 23 years old na sila. But when we realized during the interview, during the counseling period, na they've had sex earlier than that, as early as 15 years old. So ganun talaga ang facts ngayon.
Pero masasabi mo ba, Miss Fritzy, na mas marami na tayong cases talaga din ngayon na nakikita dito sa ating city, kaya tayo nasasabi na hotspot tayo? Or would you say na nag-stabilize yung number of cases?
Still growing.
Still growing.
We look at it as both ways. Yun nga, marami nang nakakarinig that services are here and it's for free and they can access it in many institutions. Plus, probably, increasing lang din talaga ang kaso.
Ang kaso
so
natin.
it can be both ways.
Okay. Now, so balikan kita, Dr. Evelyn. So sinabi niya, increasing din tayo dito sa city.
Yes.
Would you say na heto is something na para bang alarming to the point na kayo, your programs, you might need to review your programs?
Yeah, that's why we have to link, no? We have to link with the other sector of the society. So hindi lang ang DOH or hindi lang sa health sector, but also we have to link the other sectors. If we review with the program, we have done a lot already in the Department of Health and as well as the health sector in general in terms of addressing this. But since this HIV and AIDS is not only a biomedical problem, but it involves socio-cultural, political, and economic.
Yes, kasi 'di ba,
Yes.
mapapansin natin even sa World Health Organization, they keep saying na this is more of a problem, a menace that involves low socio-economic countries Hindi naman yung mga highly urbanized
Yes.
countries or industrialized countries ang maraming cases, kundi yung mga nasa low to medium income group So why do you think would that be kaya?
Yeah, that's true. Because number one, in a low-income country, later on you will know that with the budget, yes, there is already a gap in the budget in terms of addressing this problem. And then, in terms of our health workers, there is
Kulang na
also
kulang din.
din. In fact, multiple functions. One health worker has
So
multiple
grabe ang
functions.
multitasking natin.
Grabe ang multitasking natin. But the good thing is there is the commitment and very committed and knowledgeable ang ating mga health workers. It's lang, maulang na. Although, kumukunti talaga tayo.
Like
It's
yung
really a
yung
fact.
sa inyong yung sa inyo naman, Miss Fritzy, 'di ba? You are an NGO, yung sa MOCAN. Ilang members kayo nandoon? And lahat ba ng mga members na yan, na mga kasama ninyo, ay also truly committed, like sinasabi ni Doktora, in helping out?
Yes. MOCAN has a member of close to 50 NGOs, GOs, in fact, academe, religious organizations, civil organizations, yun lahat. More or less 50. Tapos, each representative who really sits closely with MOCAN are trained.
So
VCT
hindi lang
counselors.
kumbaga hindi lang sila pwedeng pumunta doon na hindi sila kailangan i-train. Kailangan iti-train ninyo sila.
Iti-train talaga sila.
Kasi special to
Yes. Para maging marunong din sila to handle clients.
So dapat knowledgeable sila
Yes,
as to the transmission as well as to the movement of the virus,
And
diba?
even the skills.
And even the skills.
They have to have the skills.
Yeah, kasi when we return mamaya, we will be discussing paano nga ba itong, kasi iba ang HIV, iba ang AIDS eh. Minsan kasi napapaghalo-halo natin yon. So please stay tuned, and when we return, we will have an interview with our very special guest after this break.
From the 7,107 islands of the Philippines comes our sun-kissed warm congratulations to Hope Channel's newest milestone.
We are proud to be a part of the Hope Channel team. This is the Lord's work.
He will carry us through.
And Team Philippines is with you all the way.
To the worldwide ministry of the Hope Channel,
Welcome back to Dynamic Living the Total You with our episode Life Beyond HIV/AIDS. And I am very much honored, of course, to have with me here a friend of ours, JP. I'd like to welcome you to Dynamic Living, at kami po ay nagpapasalamat at kami ay inyong pinaunlakan. You know, it takes a lot of courage to be able to share your life, considering na yung iba talaga nahihiya pa, no? And with you coming out and telling us and sharing with us your experience, we know that it will serve as a beautiful lesson to our viewers and to the people who will be listening to us tonight. JP, were you aware kung paano nagkakaroon ng HIV/AIDS ang isang tao?
Before po, ma'am, mga early age, mga 15 years old. 15 years old po kasi ako nag-start into sexual activities due to hindi ako masyadong mabait na anak. So, habang nag-aaral ako, hindi ako pumapasok. So, nalaman ng parents ko, tapos pinagalitan. Yung isip ng bata ba na pag pinagalitan, so hindi ka na love. So, lumayas ako sa bahay namin at the age of 15, and I have to support myself. So, wala akong ibang naisip na paraan kasi 15 years old na po ako. So, pumasok po ako sa mundo ng prostitusyon at the age of 15 dahil kailangan kong mabuhay dahil walang sumusuporta sa akin. So, at that time, kahit sino po yung partner ko, tapos ang kasex ko po is yung unprotected tsaka protected kasi may mga times po na unprotected kasi dahil po sa pangangailangan, wala po akong choice kundi pumayag na makipag-sex na unprotected dahil kailangan nga po ng pera.
Sinabi mo, JP, na 15 years old ka nung nangyari yon. Ilang taon ka na pala ngayon?
24 na po, ma'am.
Okay, so 15 and then 24 ikaw. So, hindi mo alam kung paano dati, di ba? Paano magkaroon ng sakit ang isang tao na kagaya ng HIV. Sa paniniwala mo, or kaya na feel mo ba na dahil sa mga ginawa mong yan, kaya ikaw nagkaroon ng sakit?
Opo, ma'am. Kasi yung mga coming years na po, parang na-educate na po ako na ito po yung mga transmission ng HIV, yung anong mga paraan para mahawa ka. So, wala naman po akong parang ibang ginawa nun, hindi naman po ako nag-IDU or nag-inject ng drugs. So, yun lang po talaga ang
Ang pwedeng dahilan kung bakit ikaw nagkasakit. So, kailan mo nalaman na nagkasakit ka? Like, you started at the age of 15. Ilang taon ka noon nung nalaman mo na, teka lang, kailangan yata ako magpa-examine?
Yung ano po, 21 years old po ako, nag-start na po ako magkasakit. So, by that time, siguro mga early 18 or 19, siguro positive na po ako. Pero medyo mataas po yung ang immune system, CD4 ko po. Tapos, by the age of 21, so parang bumaba po kasi that time, bumalik ako sa pag-aaral kasi umuwi na ako sa bahay namin. Thank God po na welcome din pa rin po ako ng mga parents ko.
So, nung 21 ikaw, yun yung first time na nagpatingin ikaw?
Opo, kasi
ano yung naramdaman mo noon? Bakit naisipan mo, teka lang, kailangan yata ako magpa-check up?
Kasi parang balik-balik po yung mga sakit ko, tapos hindi gumagaling. Tapos for 2 months, nag-suffer po ako ng diarrhea. Everyday po yan, parang
Madali kang, ibig sabihin, madali kang madapuan ng sakit. So, kaya ka nagpa-check up. So, nung nagpa-check up ikaw, sinabihan ikaw na positive ikaw sa HIV?
Hindi pa po. Yung doctor po kasi noon is hindi po niya ako ni-refer sa magpa-test ng HIV. Parang ang ginamot niya po is yung mga sakit ko lang po. So, may friend po ako na active din po sa sa advocacy ng HIV at saka AIDS. So, parang nakita niya ako kasi namayat na po ako, tapos parang umiba na po yung itsura ko.
Hindi ka nagwapo.
So, sinabi niya na baka gusto kong magpa-HIV test kasi yun nga, ginawa na namin lahat, wala pa rin effect yung paggamot sa akin. So, sabi ko sa sarili ko, bakit hindi? Parang wala namang mawawala kung magpapatest ako o hindi.
So, nung nalaman mo na positive ikaw, ano yung una mong naramdaman?
Yung first po is parang na-depress po ako kasi tinanong ko nga po si God na bakit ako nahawaan ng ganito. Pero parang na-realize ko rin po na wala po akong right mag-ask sa kanya kasi ako naman po ang may gawa yung ginawa ko noon. So, parang gusto ko lang po na yung panahon na yun is na-realize ko na life must move on. So, hindi kailangan mag-stop ang life mo if ever na HIV positive ka na.
So, pumunta ikaw sa mga organizations na may advocacy ng HIV/AIDS? Sumali ka?
Kasi yung friend namin is member siya ng Mindanao AIDS Advocate Association Incorporated, yung organization po namin ngayon. So, parang ni-refer niya ako na mag-join sa kanila, ganyan. So, sabi ko, okay, kasi napag-isip-isip ko po na even though na HIV positive na po ako, so, kailangan kong gumawa rin ng paraan para ma-stop yung spread ng sakit.
So, sinabihan mo ba yung mga magulang mo nung nag-positive ikaw ng HIV/AIDS?
Opo, pagka-receive ko po ng result is, pero yung pinasabi ko yung ate ko po kasi mas close kami ng ate ko kaysa sa parents ko. So, yung sinabi ko sa ate ko na positive ako, so parang nalungkot siya at umiyak siya. Tapos tinanong niya ako na baka gusto mong sabihin sa parents natin. Sabi ko na, hindi ko kaya, ikaw na lang, sabi ko sa kanya. So, sinabi niya, tapos yung parents ko is, yung initial reaction lang na parang na-depress or nagalit sa akin. Pero after ilang days, tinanggap din nila ako dahil parang anak lang.
So, sa ngayon, you are undergoing treatment?
Opo. For 2 years na po, umiinom na po ako ng ARV.
And kumusta naman ang pakiramdam mo ngayon, considering na umiinom ka ng gamot?
Parang, kasi naka-adjust na po ako sa mga reaction. Pero yung trial period po kasi, may mga side effects po talaga ang gamot. So, for 2 years, parang na-adapt ko na po yung mga reaction.
So, ngayon, anong pinagkakaabalahan mo ngayon, JP?
Active po ako sa organization namin. So, parang kasi napag-isip-isip ko na itong organization na to is natulungan ako noon. So, I think this is the way na makatulong din ako sa iba, yung mga positive din sa HIV.
So, you have plans for your life? From the time na na-diagnose ka, nagamot ikaw ngayon, ongoing ang treatment mo, would you say na bumalik ka ba ng pag-aaral mo ngayon?
Gusto ko po pero parang gusto ko munang maging more active po sa advocacy. So, if may, may, gusto ko pong bumalik sa pag-aaral.
And what are your plans?
Plans ko po is siguro, kung hindi ko man magawa mag-isa, I'll start with myself siguro to stop the spread of HIV. So, parang useless naman po kasi pag salita ako ng salita tapos hindi ko naman ginagawa. So, I have to start with myself. So, even though HIV positive lang ako, so, gagawa din ako ng paraan para makapagbigay ng information sa...
So would you say na you are happier now, JP, considering na, you know, after going through that difficult stage in your life and getting, you know, to be tested positive, you have to go through the treatment, and syempre, you go through a lot eh. Hindi naman sabihin natin na depression one day lang yan, di ba? Would you say na you feel better now knowing na meron kang mga kasama sa grupo ninyo na nakakaintindi sa'yo at meron kayong advokasya upang makatulong din sa iba?
Minsan nga po ma'am, parang natatawa ako kasi parang yung after ko nag-positive sa HIV, parang naging mas better person po ako kasi kaysa noon. So, parang more matured na po ako ngayon kaysa sa noon po.
Lagay mo kaya, JP, ang ating government or ang ating ahensya dito, lalo na sa Cagayan de Oro or dito sa Philippines, is capable of handling mga HIV cases?
Siguro in services po, parang medyo nakakaya na naman po ng gobyerno, pero financial problem po siguro parang doon nagkukulang. Kasi yung ARV po namin ngayon is parang hindi po outside sa Philippines po ang nagsusupport ng ARV. So, kailangan po talaga siguro na kahit kung wala na mag-support, parang kailangan ng gobyerno ng...
So, ano kaya magiging mensahe mo sa mga tao na nakikinig o nanonood sa atin ngayon?
Siguro ang message ko lang po is hanggat wala pang virus sa katawan, so siguro dahan-dahan lang po dahan-dahan ng mag-stop yung mga risky behavior. Kasi isa lang po ang pinapaliwalaan ko, yung prevention is better than cure. So ako is wala naman talagang cure ngayon sa HIV, pero pwede pang ma-prevent ang spread. So stop or encourage na stop yung mga risky behavior na ginagawa ng
Okay, maraming salamat sa iyo, JP, sa iyong panahon na inilaan para sa amin, and I am very sure na kung sino man yung nanonood at nakikinig sa atin, they are enlightened and your life is a message of hope to them. Babalik po kami, please stay tuned.
From the 7,107 islands of the Philippines comes our sun-kissed warm congratulations to Hope Channel's newest milestone.
We are proud to be a part of the Hope Channel team. This is the Lord's work.
He will carry us through.
And Team Philippines is with you all the way.
To the worldwide ministry of the Hope Channel,
Mabuhay!
Kitang tanan pwedeng magkasakit, pero ako, daghang sakit nga pabalik-balik. Sa pagpakonsulta na sayran nga ako, HIV positive. Dugay na di ay na akong dala ang HIV, ug bag-o lang nagpakita ang mga simptomas.
Kung naamoy pagduda, pagpakonsulta, kaysa balaod ang imong pagkatao, protektado, tawag sa 088-856-3312 o pagbisita sa Alagad, Mindanao, Door 6, Nelfago Apartment, MH Del Pilar Streets, Cagayan de Oro City.
Welcome back to Dynamic Living the Total You with our episode, Life Beyond HIV/AIDS. And so ngayon naman, back sa aking dalawang guests, si Dr. Evelyn at saka si Fritzy. Narinig ninyo yung aking interview doon sa ating guest, no, si JP. And na-realize natin na marami pa tayong pwedeng gawin, no, to be able to reach out to them, dun sa mga affected, at the same time, sa mga families nila. Pero, Dr. Evelyn, kailangan i-differentiate muna natin ang HIV from AIDS. Kasi minsan, yung fear ba na naka-attach doon na pag sinabi mong AIDS, ito mamamatay na siya. Hindi naman dapat ganon. So, ano ba to ang difference ng HIV at saka ng AIDS?
Okay. So, yung HIV is human immunodeficiency virus. Virus yan. So, pag pumasok, if that virus gets into our system, it only infects, no, human beings. So pag pumasok sa ating human system, we become infected. At ang inaatake ng HIV, the virus would attack our immune cells. That's why it's called immune.
Kasi yung immune cells natin, sila yung responsible for, to act as a defense against all kinds of invading organisms.
Yes, but what happens is, doon sila pumasok sa ating immune cells. And then, they multiply there. They replicate inside our immune cells, the T lymphocytes, and they damage. Once damaged, that's the time that ang ating immune system, yung resistensya of our body bumababa. Yun pumapasok other infections. May it be bacterial or other viral infections or fungal infections. So, nawala ng kakayanan or deficient na ang ating body. Wala ng kakayanan to fight against all of these infections. Kaya pag ang sinasabing AIDS, ay yun na ang tinatawag natin acquired immune deficiency syndrome is acquired because na-acquired lang na siya na it's a syndrome because it's composed of several diseases. And it's acquired, these infections or diseases are being acquired because
deficient
na ang ating immune system. Wala ng protection.
So,
kaya it's
usually, how long does it take? Kasi syempre, alam natin, it's a virus di ba? So, there is no other way of transmitting it kundi tao sa tao.
Yes.
Diba? And nasabi na natin kung paano nila ma-acquire yon. So, heto, Miss Fritzy, syempre, pag kayo, nagle-lecture kayo sa inyong advokasya, dapat alam ng ating mga viewers din na hindi naman ibig sabihin na pag may katabi ka na positive siya, o kaya may AIDS siya, mahahawa ka, di ba? So, we want to do away with that,
Meron ngang 3 modes of transmission, hindi ba? So, lahat ng ito, may it be blood products, unprotected sexual behavior, mother to child, lahat ito can be prevented. So, hindi pwedeng nagkatabi lang kayo ng isang PLHIV or person living with HIV/AIDS, mahawa ka na. Hindi ganon yun. Or kahit sa kissing.
Kahit na nga sa baso.
Yes, sa baso,
kaya
sa
mga
kutsara.
utensils,
Yes.
diba? Kasi alam mo, yun yung nagiging stigma na parang nadidiscriminate ang ating mga kasamahan na naging positive nito. And maybe this is one reason why they don't want to come out in the open and seek treatment.
Yes. And kasi ang sabi is, pag nandun na ang infection ang virus sa body natin, you will be infected for life. And there is no cure.
No cure talaga ito.
There is treatment. Meron tayong tinatawag na antiretroviral drugs, but it is not to kill the virus. It's just to boost, to improve the immune system. Yes.
So kung kumbaga, when you have it, once you have it, that's for life
Yes,
kaya
that's
nga,
for
diba,
life.
Kaya nga ang problem natin sa HIV is it's a chronic illness It can last you a lifetime, di ba? Not necessarily na pag positive ka ngayon, mamamatay ka na. Hindi ganun yun. Sometimes you live up to 20, 30 years, 40 years even from the time na na-diagnose ka, di ba? So, heto, punta natin yung Millennium Development Goals ng World Health Organization. Sabi nila, ang ating WHO, merong Millennium Development Goals. Kumbaga, meron siyang tinatawag na target niya na kumbaga, by year 2015, dapat 0 new infections. Ibig sabihin, walang bagong kaso. 0 death, walang namamatay kasi meron nga naman tayong treatment. Tapos 0 discrimination. Ano ba ito, Doktora?
Yun nga, may target tayo sa Millennium Development Goals that by 2016, dapat mo half ang ating yung TB and HIV and other infectious diseases by half by 2015 or 2016 na ngayon. At ang ating strategy is dapat, global strategy is getting to zero. That means in order to achieve that MDG by 2016.
Ibig sabihin nun, walang bagong kaso?
Yes, walang bagong kaso. No, zero discrimination. And zero AIDS-related deaths. So paano yan?
Masyado yata ambitious,
ambitious.
Yung ating WHO, napaka-ambitious. Pero kasi, you cannot blame WHO. Yes. Alam mo kung bakit. Marami silang mga MDGs na na-accomplish eh. Like, di ba, nagkaroon tayo ng zero polio. Yes. Nagkaroon tayo mayroon tayong ngayon na yung ating malaria, dapat, ganito lang dapat. So kaya siguro sila ganun ka-aggressive sa kanilang pananaw na dapat zero din tayo, new cases ng HIV/AIDS.
Yes, that is a good sign. If other countries can do, why cannot we? With the new good antiretroviral drugs, and now we have the innovations that treatment is a prevention. So we give early antiretroviral drugs in order to reduce the viral load, and that would reduce also the risk of transmitting the virus to others,
kasi
to the partners.
Diba kasi heto, ang neto hindi naman natin sila pwedeng i-prevent, diba, Miss Fritzy, na mag-asawa sila o magkaroon sila ng relationship nila, diba? So, I'm very sure na our viewers must be wondering na kung sakali meron ikaw nito, mag-positive ikaw, dapat ba you have to refrain from getting into a relationship, na a lasting relationship, kasi baka magkaroon siya ng sakit din, or hindi naman dapat?
Hindi naman. Kasi as an AIDS advocate, I feel na basic human right ng tao yan eh. May sakit siya ng AIDS o wala. So, hindi natin dapat stop kung ano man yung right niya. But, mayroong mga options. We have A, B, C, D, E para ma-prevent ang pagkuha ng ganitong sakit. For example, letter A, abstinence. So, para sa mga single na tao, sa mga kabataan especially, ito yung panawagan namin. Abstinence. Abstain from sex. But, hindi kasi natin pwede bigyang isang option lang eh. Ang tao dapat may ibang option. So, there's letter B. And what is that? Be mutually faithful with your partner. So, that goes with the married couples. Be mutually faithful. Hindi pwede yung asawa lang. Yung isa merong iba. Mutual dapat. And still, with those single people who are into sexual act na with their exclusive partners, ito rin yun. Be mutually faithful with your partner. Stick to one. Although, sa mga parents like me, sa educators like me, we don't advise that. We don't encourage that. Sa abstinence talaga tayo. But bigyan natin sila ng option to be more effective sa kampanya natin. Hindi talaga pwedeng isa lang ang option. Letter C, careful sex. Care for yourself. That's letter C. And when we say care for yourself,
you also care for your partner.
You also care for your partner. So both ways yan. Ayaw kang mahawa yung sarili mo. Ayaw mo rin mahawaan. Especially kung ikaw mismo hindi mo alam ang status mo. So if there's that risk, ikaw mismo makapagsabi na I have to take the test. I'll have to submit for VCT. So care for yourself. Andun din yung option na to use condom. Correctly. And consistently. Hindi dapat pinipili lang yung partner. Especially those who are into multiple partners. So, letter D, do away with drugs. Kasi if we are not in control of our body, yung iba baka may magsamantala. Especially on intravenous drug using.
Lalo na kung mga bawal na mga gamot ito.
Yes, because through intravenous drug using, dun yung nagbabaro ng syringe, ng needles. So, dapat isa-isa lang. And letter E, education. Ito yung ginagawa natin ngayon. So we're very glad to have this kind of opportunity because sabi nga nung isang expert, Dr. Jean, sabi niya, media practitioners, teachers, and parents who have the chances to talk about HIV/AIDS, how to prevent, how ganito, ganyan, mas marami tayong masave
Totoo yan.
na mga buhay kaysa sa mga doktor na nasa hospital. Iilan lang ang pupunta sa
hospital.
hospital.
Miss Fritz, ang point din we are into prevention
Yes.
Kasi prevention pa rin tayo, di ba?
Yes.
So balikan natin si Dr. Evelyn. Dr. Evelyn, usually yung alam natin incubation period from the time na meron ikang partner na hindi mo alam kung meron siya o wala, usually how long would they say na heto ang virus ay matatransmit sa'yo?
Okay, yun nga. Ang HIV infection, there are 4 stages. So yung initial stage, stage 1 is, hindi mo alam. The virus is already there. Tapos ang about around 3 weeks to 6 months, hindi pa nakikita ang virus.
Pero yun yung
But
time
it's not detected.
Yes,
I mean,
undetected.
it's not detected.
Yes.
Our test is through antibodies, no, through the blood, detecting antibodies against the virus,
which can be negative.
Negative during the first stage.
Kaya yung iba kampante.
Yes.
Kasi sabihin nila na, I will submit myself to this examination. Negative naman ako, so pwede
that's
pa.
The window period.
Window period yun.
So, only a few or less than 20% na may symptoms na would go to the doctor consult. But when tested, negative
pa rin.
Yes.
Tapos
parang viral flu.
Kasi at saka
symptoms.
yung sinasabi mo, doktora, di ba kasi nga viral siya So ang manifestations niya parang kagaya lang ng flu, kagaya lang ng dengue minsan, kagaya lang ng iba-ibang mga sakit na kumbaga nanghihina, masakit ang ulo, nilalagnat, So very young, so wala lang sa kanila yon. Yes. Tapos noon.
So tapos when the time comes na medyo dumadami na ang virus and then mag-reduce na ang ating T lymphocytes, the immune cells that were being attacked, saka na yung stage 2. May antibodies na lumalabas, madidetect na. But at this time, walang simptomas.
Asymptomatic naman siya.
Asymptomatic. And it could last for up to 10 years without symptoms.
So yun yung delikado. Kasi yun yung time na magta-transmit siya
From stage 1 pa, delikado
na.
Hindi alam mo, and then yung sinabi, yun ang problema. Yun ang risk is they continue to engage and majority is sexually transmitted. Our young population, adolescents, children now are very
yung kanilang behaviors nila.
Yes. And then they seem to be independent. Yung sinabi ni JB kanina is at the age of 15. So feeling independent na, kayang-kaya na. Kaya pa ba nila to face that responsibility? Aware ba sila ng consequences? Aware ba sila of this virus? No.
No, hindi nila alam yun.
Hindi nila alam. Kaya yun.
Minsan aware sila, but they take it for granted.
At saka hindi, kasi makikita mo yung psyche ng mga kabataan na yan. Yung psyche nila is parang they're immortal. They're beyond sa mga sakit na yan. Kasi mga bata pa nga sila. They're so aggressive and they feel na walang makaka-apekto sa kanila.
Adventurous.
Yes, very much.
Yes, very much that age. So pag stage 2, wala pa rin. Walang simptomas. So if they cannot access, if they do not know their status, they are not able to even to protect, to protect during sexual intercourse or during sexual activity, to protect others.
So imagine mo 10 years.
mga loved ones nila.
Yung 10 years na yan.
Yes.
Ang dami mo nang naapektuhan yan. So sa stage 3 naman?
Ang stage 3, ayun na. Yung medyo marami na burnout na ang ating immune cells, the T cells. Kaya yun, bumabagsak na yung CD4 count natin. Kaya meron ng opportunistic infections. Yung sinabi natin kanina na one of the most common opportunistic infection. Opportunistic because sumasabay lang sila pag wala na ang ating
kumbaga nakikisakay lang
sila. And TB is being number one is in the Philippines, in the world,
In the
number
world,
2 tayo.
yes. Uh-huh.
In terms of notification of TB cases globally, number 2
And to
tayo.
think-
So maraming TB cases.
And to think na ang TB is endemic sa country natin.
Yes.
So ngayon, sasakyan pa niya yung
sasakyan
HIV/AIDS,
niyang
lalong
HIV.
magbo-blow out of
Yes.
proportion yung cases natin.
Dadami.
Pero worse pa niyan, Dr. Evelyn, yung TB na ito na sumasabay doon sa HIV cases natin, ito yung mga multiple drug resistant strains. Ito yung mahihirap gamutin.
Gamutin. Dahil, ang risk dyan, pag may HIV, the person living with HIV there is higher risk nga mag-recurrent TB. So, pag recurrent TB, paulit ang ating treatment. And probably because may stigma pa, nagsi-self-medicate pa sila.
Yes, kasi ayaw umamin, ayaw lumantad.
Kaya, mas lalong lumalala yung TB, nagiging drug-resistant TB.
And ang problem kasi, dahil ang TB, alam naman natin, airborne, aerosol, di ba? So, katabi mo lang dyan sa jeepney, inuubo na. Hindi niya alam, hindi niya tinatakpan yung bibig niya. Tapos, MDR positive pala siya na TB. So, kinalat niya sa mga lahat ng 10 kasama niya doon sa kasabay niya sa jeepney. So it becomes, now a compounding problem for us.
Yun yung may ano nila. Although, ang TB is, yung naapektuhan ng tuberculosis, yung close contact.
Yes.
Yung living within the same household. Eating with the same...
Kasi by utensils yun
it's not transmitted through utensils.
Saliva,
so, close contact na.
Ganyan,
And kinsa man yung pinaka-close natin, yung nasa bahay.
Kasama magulang, mga anak, mga asawa.
Lalo na yung mga anak.
So,
malaki ang tsansa pa rin nang na-transmit niya yung may HIV. Yung HIV na hindi niya alam, yun. So, there is a risk nga 5 to 15 times annual risk nga magka-infect. I-compare, so yung walang HIV, nga 5 to 10% lang throughout the lifetime nga magka-TB.
So, ngayon, balikan natin yung sa MDG, yung Millennium Development Goals. Tayo ngayon, knowing na yan yung background dito, would you say na tayo yung government natin has programs to be able to address so that we will be able to reach itong 0 new infections, 0 deaths, 0 discrimination?
Yes, marami tayo dyan. Doc Jane, in fact, nandito na ngayon sa 5th Age Medium Term Plan. This is our strategic plan to address this health issue of HIV. So, meron tayong mga strategies. So, by this time, sana, and one of the strategies, 5 sila. Yun is to improve yung information dissemination, education to
Diyan papasok yung kanila FITSI na advocacies nila.
Then, so dapat, and addressing the most at-risk population. Kasi, sinabi ko kanina, meron tayong gap na funding. So, we must focus to sino yung key affected population, marami. So, kaya dito sa Cagayan de Oro City, maraming may fund tayo sa global fund support na para sa males, MSM.
Males having sex with
males. Kasi peer educators. Kasi yun lang, ma-reach out natin sila kung katulad nila. So,
paano yun, Ms. Fritzy? Ang ano nun? So, yung mga peer educators, under sa inyo yan? Kasama yun sa inyong program?
We have here for MSMs, we have Tingog CDO. So, sila yung kinukuha ng DOH, ng City Health Office natin, para mag-conduct ng
symposiums.
At saka talagang nakikipag-usap sa mga cruising sites, sa mga ganyan, kinakausap nila, ini-encourage nila yung kapwa MSMs nila para mag-undergo ng visiting.
So, pag kunyari sila, pakiramdam nila, alam naman natin yan kung may risky behavior tayo. You don't have to be told, di ba? Alam mo naman na early sexual contact mo, multiple partners, o kaya hindi safe yung iyong sexual behavior mo, or risky yung iyong behavior, o yung occupational hazards mo, yung mga ganyan. So, papaano sila? Saan sila unang pupunta?
Kaya ngayon, the second strategy is we need testing centers. So, HIV testing centers. So, dapat maka-access sila sa ating testing centers. Kaya we are expanding our testing centers and it should be, the testing centers should be accredited and proficient testing center. We have proficient medtechs trained,
Yes.
as well as in every testing center, we require sana there is always a counselor, trained counselor also.
Kasi hindi naman po pwede na magpapatest lang siya, walang counseling. Di ba?
Yes,
At
that's
saka,
illegal also.
Illegal. At saka hindi, dapat alam ng ating mga viewers na pag sila pumunta naman dun for a test, it's kept confidential.
Yes.
Di ba? So we need to assure
We
them that.
strictly adhere to confidentiality.
And
Talaga.
siguro din, kasama doon sa proficiency, pag sinabi nating proficiency ng mga tao sa laboratory na mag-examine, hindi lang yung technical, kundi yung pakikitungo nila sa kanila, na kumbaga, hindi mahihiya. Hindi mahihiya yung pupunta doon na gusto ko magpa-test nito. Kasi minsan sila, they get embarrassed just going there, di ba? Oo.
Kaya nga, hindi na sila, yung iba, nagpa-test pero hindi nila kukunin.
Yung
They're
result.
not going to get the result.
Yes.
So, useless ang testing natin. Bakit there should be a counseling before the test and before
And
after the test. So, because they will be counseled and they would develop an informed behavior change or informed choice what they're going to do with their life if ever negative or
positive.
So,
at saka maganda yung may counseling kasi kung nasa window period nga siya, di ba, ma-explain ng counselor doon na heto, it should not lull you into complacency, di ba? So yun yung pinakamahirap doon eh. So kung in case na nag-positive siya, ang treatment ba available ba sa atin? Does it cost so much? Kasi syempre isa din yan sa concerns nila na yung cost eh.
Yes, that's why yun ang second strategy natin is yung accessibility ng testing centers, no? And the third is yung availability ng treatment centers. And good news for Cagayan Region 10, meron na tayo pang 18 from the 18th treatment hub.
So,
in the Philippines. So,
isa tayo.
Yes, isa tayo. So, at least, yung mga people living with HIV natin dito, sa ating region, hindi na pumupunta sa ibang regions. Which in Mindanao, 3 lang ang merong treatment hub. Tayo ang pangatlo. Yung una is Davao, SPMC, and then yung pangalawa is Zamboanga. So, ngayon lang, just recently, last July, just September, they received the...
Saan yan? Yung treatment
sa
hub
Northern
natin?
Northern Mindanao Medical Center.
Pero kailangan siguro, mas maganda siguro na encourage natin sila na bago sila pumunta dun sa treatment hub, baka pwedeng dumaan muna sa inyo.
Yes. Kaya nga, there's a network. Kasama sila.
Merong referral nga na dadaan muna sa VCT. Testing is part of VCT actually. So from pre-counseling, if ma-found out doon sa pre-counseling na may high risk siya during the assessment, that's the time mag-test.
I-refer,
Dito sa Cagayan de Oro, sa City Health for example, sa Social Hygiene Clinic, less than an hour, makukuha na yung result ng test. So it's gonna be non-reactive for negative and reactive for positive.
Yes,
so,
screening yun eh.
Yes, If ma-found out na reactive siya, i-refer yung specimen sa Manila.
For confirmation.
Yes, RITM or anywhere else in Manila for confirmatory. So it may sometime
take time.
Take long.
So yung medications ba nila, libre ba yan?
Yes.
They can avail of
Then
that
after
free?
that, pag may confirmation na, tapos there will be a required test also for CD4 count.
Yes.
Because sa ngayon, ang standard, they can only avail of the free ARV as soon as bababa sa 300 ang CD4 nila. So, immediately after malaman yung CD4 count na below 300, i-enroll na siya for ARV treatment.
Pero,
doon sa hub team
sa kanila yon,
team
doon sa NMRTH. Pero from your perspective, would you say na with all of these new developments, eto better ang ating mga antiretroviral drugs, and then meron tayong treatment hub, very active ang ating mga NGOs dito, and considering na meron tayong mga programs that are being set in place with the active information dissemination, would you say, Dr. Evelyn, na it would help a lot, curbing the increasing number of new cases?
Yes. In fact, we already have started, the first strategy is that linking with our NGOs. So our organizations and the peers. So with the help of the NGOs and the Department of Health as well as our LGU, we have topped our peers. So we train them as they become peer
Counselors,
educators.
yes.
So then they have it's ongoing now. For just this year, no, we have doubled the number of tests, no, or persons being tested. So it's more than double.
In other words, napaka-aware na nila.
Yes, they're more aware
so,
of that.
hindi na sila nahihiyan lumabas din.
So kaya nga tumaas ang ating
cases.
And the good news, if they were able to access the testing centers, they will be guided where to go.
So that means,
alam
kumbaga,
nila,
matuturuan sila paano ang next na mga steps na gagawin nila.
And then malalaman nila kung sino mga partners nila.
Yes. Napakabilis ng oras ko dito sa Dynamic Living The Total You. Tapos na po ang aking isang oras. Marami pa dapat kaming i-discuss. Maybe we can do a part 2 of this para naman mas comprehensive at exhaustive ang ating discussion on the topic. I'd like to thank Ms. Fritzi for joining us in the show. Would you like to say something that would inspire our viewers?
So, very thankful kami na andito kami sa channel, Hope Channel rather. Thank you very much for the opportunity, Dr. Jean.
And Dr. Evelyn?
Okay. So, in behalf of our Regional Director, Dr. Aristides Concepcion Tan, I would like to thank Hope Channel, Dr. Jane, for giving us the opportunity to talk, to give this information in the Hope Channel and to give hope and light to our people who are living with HIV, that there is life beyond HIV and AIDS.
Yes,
and we are marami tayong kasama sa kanila.
Na hindi sila nag-iisa lang.
Hindi sila nag-iisa.
Kumbaga, meron silang katuwang sa buhay nila. There is life beyond HIV/AIDS. Yan po ang ating topic ngayong gabing ito. Remember that awareness and getting the correct information can save a life. Ignorance, would always bring disaster to a person. Maintaining a healthy lifestyle, yung sinabi natin na 5 options na we have, will always also help and go a very long way into preventing or maybe protecting one from having the disease. There is always hope and help for the affected and for the families out there living or knowing that your son, your daughter, or maybe a close family member that may have the disease. Please give them the support, the emotional support that they need, because at the end of the day, mahal pa rin po natin sila. Magandang gabi po sa inyong lahat.
Presenting the all-new Hope Channel. Clearer.
Mga personalidad nga dunay kaikag sa pagbarog sa
kami nga magtiayo. Kaya siya nga nagpamatuod. Na kung ikaw
Brighter.
I was confused because ginatanaw nato nga wala na tay kakampi. We are
Stronger. Arresting the attention.
Bonus na kung maging positive and it makes you
deadly in earnest.
Right now, the campers are having their hiking.
Bringing Christ to Mindanao.
Ang tubig igsuon importante kayo.
Let's listen to what the nature will speak to us.
And bringing Mindanao to the world.
Dynamic Living The Total You, live in Guide.
To feel the touch of His redeeming love.
And the world to come.
akong right lobe, kumplito na siya.
Sa diyang nagtawag ko,
Yes, Hope Channel Philippines will show you
there's hope in Jesus, and there's more to life.